Moving forward, it is a privilege for me to introduce our next eminent speaker, respected Vaidya Satyavrat Nanal sir. Sir is known for his use of single herb drugs and herbo-mineral combinations from Ayurveda. He has an elaborative work on concept of Ayurveda and non-vegetarian food with reference to Charak Samhita. He is an acting director of Nanal Madhujeevan, an Ayurvedic monthly Mumbai. Sir has delivered various interviews on Indian television, radios, newspaper coverings, concepts of Ayurveda, and various Indian festivals, various diseases like diabetes, acidity, and many more. Along with human, as a hobby, he treats animals, birds, and plants with Ayurvedic medicine. I would now request Sir to please begin with his lecture.
मैं वैद्य सत्यव्रत नानल आज का जो सब्जेक्ट है परिभाषा, ये सिलेक्ट करने के पीछे एक बेसिक कारण, अगर आयुर्वेद समझना है तो आयुर्वेद की संहिताओं को समझना ज़रूरी है, ऐसे हम लोग हमेशा बोलते हैं। कॉलेजेस में जाके हम लोग वो सब्जेक्ट्स पढ़ते हैं। ओके, उसके पहले हिंदी और इंग्लिश और मिक्स कैसे चलेगा वो आप एक बार बताइए। तो इंग्लिश, हिंदी, इंग्लिश, ओके। सो व्हेन वी learn Ayurveda, we learn it through the texts written, or at least it is expected to learn from the texts written. And that text, if we have to understand, then how we can, or how we have to understand it, how the Granthas have already told us to understand the text in a particular way. I will try to put it in front of you today. That's why this topic is selected. Now the first line is Paribhasha. I guess the font is missing. When we talk about Paribhasha, we have to first understand what is the word Paribhasha. Paribhasha is two words. The first is the adjective. Meaning is whole, complete, or full. It is an adjective which is then used along with bhasha. So the exact meaning is every science has its own language. To understand the subject, learning the language is the most important part. Unless and until we do that, we can't reach the ultimate core knowledge which the Samhitas are trying to give us. Now, after Paribhasha, the words which we are trying to understand, the first word which we are trying to understand is Ayurveda, because the circle starts from there itself. So the word Ayurveda is Ayu and Ved. So everyone knows knowledge of life is a definition given to Ayurveda nowadays. And why this? Because every word used in the text has exact meaning. The words are not used loosely anywhere in the text. They use the words with a precision. An example I have observed in last 15-20 years is Ayurveda is categorized as an alternative science. Many people say that Ayurveda is an alternative science. As per my opinion, it is not an alternative science. It is an ancient Indian medical science. We are talking about words. So we are talking about words means we have to select the words very precisely what we are talking about. So when we say alternative medicine, that means we are not the mainstream or lead stream medicine. Is that the case? We have to ask it to ourselves. I don't believe that. I believe that it's an ancient Indian medical science. It's an individual science. So that's why words play most important role in understanding any knowledge. And same is applied to Ayurveda and its knowledge. Now, talking about Nanal Parampara, I feel myself blessed for being a fourth generation in this Nanal family where all the learned people in the past have done so many things at so many different levels. That since 1915, the Vaidya Parampara started in the family in the generations. And since then, Nanals are followers of Charak Parampara and we are proud to say so. Now, question comes is why Charak Parampara? My attention always goes to this line which Charak has mentioned. Yadi hasti tadanyatra yanne hasti natat kvachit. Every word is measured and properly used and the sutra is framed. This is a pratidnya done by Charak. When we say pratidnya, we say Bhishma Pratigya. Those words we understand the meaning, the depth of word pratigya. So when someone does some kind of a pledge, takes some kind of a pledge, that means he is not at all doing it for fun or doing anything loosely. They are doing it very precisely, and that's why this pledge is self-explanatory. It means everything written here is pure scientific and is not a work of fiction at all. Feeling of proudness comes only and only when we start believing this. If we don't believe this, if we are studying, we generally study in our educational period, we study in two ways. One is to understand the subject and second is to get marks and get pass and get a degree. If I study to get a degree or get good marks and go to the next level or next year and complete the course, I will be studying only for the purpose of exam. I will not be studying to understand the subject. But if I study the subject since beginning to understand the subject, I don't need to prepare myself separately for the exams because I have understood the subject itself. Once I learn to balance while driving a scooter or a cycle, after 10 years also, I will remember how to balance. So I have known the subject from its core. But when it comes to education or going for exams and all, we will not reach the precision of the subject. And that's why रात तक जागना और एग्जाम के लिए प्रिपेयर करना ये स्टूडेंट्स को करना पड़ता है. I haven't done it. In my entire education course, I haven't been awake at night to study and prepare for the exams because I have followed the first process. Now, how to learn? That also the Samhitas only give us how to learn the subject. So Charak also gives details of learning methods of Ayurveda. Again, why Charak? Because Ayurveda believes in Apta Vachan. Ayurveda strongly recommends to follow Apta Vachan with full trust. It is always better to learn any subject from original source than the translations or any other things. And that source is to be considered as Apta with full trust. And Charak Samhita is the oldest Apta Granth of Ayurveda, so that's why Charak is to be followed, is the logic. Again, third point, the practical aspect, is Charak Samhita or Ayurveda useful in current era? Now, this is a small example. In Kali Yuga, we see human life expectancy is 100 years. In Indian tradition, generally we give blessings like Shatayushi Bhava, 100 साल जियो, तुम जियो हजारों साल, गाने हैं. Now, if we see Charak, the textual reference, many textual references are there. One only I have quoted from Rasayan Chikitsa iti Panchamo Haritaki Yoga. There it clearly says Varsha Shatam Ajaram Vayastishtadi. So this clearly is applicable even in Kali Yuga, in today's era. This is what the Granthas only tell us. This is not the inference I have taken. It is clearly mentioned in the Sutra. We just have to learn it in that way. Now coming to the methods of Ayurveda to study a sutra, because if we study the sutra in particular way mentioned in the Grantha itself, then we will understand the subject at its core. So the method is Vakyashaha, Vakyarthashaha and Avayavashaha. This is a process which is mentioned in Charak Samhita itself. This is how every sutra, every word from that sutra is to be analyzed and understood and learned. This is what Samhita expects from Vaidyas like us. In that, Arthavayavashaha, every word is to be learned, which is nothing but the current topic or today's topic, Paribhasha. Hence, Charak only himself says this line, Vetta hi vetti anyatha bhinatti. Now, one sutra generally contains 8 words or 16 words. Out of 8 words, each word has different meanings. If we take one sutra of 8 words, the smallest one, then each word has a specific meaning and it has multiple meanings. If we take out all the meanings of each and every word, then with context to the subject we are learning, where that sutra has come, in which adhyaya it has come, in which sthan it has come, according to that subject, if we take only those meanings which are useful with the topic we are discussing and we compile them, we get few different meanings of the same shlok, same sutra. And the perspective through which I am trying to learn the sutra or that topic gives me that direction. And that's why when the Vetta is changed, the observer is changed, the result changes because he is seeing through his perspective. So why here I am mentioning this? Because I need to tell, or rather I would like to emphasize on learn the sutra not with your perspective, learn the sutra with the perspective of that particular granth. If Charak is mentioning something, then try to understand the perspective of that grantha itself. First understand that, then go to the inferences and conclusions later on. That's why Charak is well aware of this and he himself mentions Vetta hi vetti anyatha bhinatti. And by this process, I have tried it multiple times. If we take out different meanings of each word and if we try to compile with its permutation and combination, we get multiple meanings of one sutra. And if we categorize them, one with or going with the subject and one in the opposition, we will be ready in a debate and we will be knowing that what the other person is trying to come up with, and we will be ready with the answers because the grantha itself is telling us that. This is a process, and this process is known as Tattva, Shastra and Vyavahar. We have to understand the Tattva, its fundamentals through Shastra, and the implementation in whatever era we are into. That leads us to the Nidan, Samprapti, Chikitsa or whatever we are trying to do. In this entire process, what helps us is Maulik Siddhanta, Nyay, Vad, Praman and Tantra Yukti. Now this is a gross thing. After this, I'll give few examples. Starting from the main three dosh, and out of them vata dosh. Now vata dosh itself has a term vat. If I have to try to understand what the Samhita is trying to tell me, the Nirukti itself gives us many dimensions. Gati gandhanayoriti dhatu. Gati and gandhanayoho means gandhanadi sarva kriya. All the kriyas are led, are controlled, triggered by the element which is called vat. That is clearly mentioned in the Nirukti. And later on, when we go in first year and learn, we see Kafam Pangu, Pittam Pangu, Pangu, Mula Dhatava. It is not just clear mentioned over there, the reference is there itself in the word Vat. That is how the connections we have to try and find out so that we can learn the subject at its core. Because it clearly says Vayuna Yatra Niyante Tatra Varshanti Meghavat. Now, Ayurveda has a very fantastic way of explaining the things. One of them is Upaman Praman. It helps us at various levels. It is something like I show you a cow and then later on say, like a cow. So you know cow and you know now, like a cow, what it does mean. So Vata Gati is, Prakrut Gati is Urdhva, and then all the dimensions are covered later on. But main Gati is Urdhva. Now, Yatha Pinde Tatha Brahmande is one sutra which tells us whatever is going on outside is going on inside. Now, by help of Upaman Praman, I will give an example of how rain falls. In school time, we have learned that mountains, trees on the mountains help the rain to fall in the region. Why? That was the first question came to my mind. Are the mountains or the plants real reason for the rain? Because if that is so, then Kafam Pangu, Pittam Pangu, Pango Mula Dhatava is wrong. Vayuna Yatra Niyante Tatra Varshanti Meghavat is the sutra. So that means Vayu has the role. Actually, wind's upward direction blocks the cloud. If you see your weather forecast, we see directions of wind shown over there. From there we can understand if the mountain is there, Vayu Gati is Urdhva, if the Vayu is coming and it is getting hindered by the mountain, it is going to go upward. A curtain of Vayu is going to be there which is going to stop the cloud. Not only stop the cloud, but a friction, a movement, Gati, is going to get created over there. That Gati is going to induce an heat element by which the raindrops are going to get generated from the clouds. This is the entire process going on when the rain falls. Now we have to understand this. If we understand this, then we can understand same processes can occur in the body. Various type of secretions happen in the body. We loosely just follow saying, okay, these are the hormones, how they secrete. Through the Ayurvedic perspective, how we can elaborate secretions of various subjects or objects happening in the body. This is a way by which we should think about it. When the subject will change, only the context will change, but the process remains same. Yatha Pinde Tatha Brahmande is the Nyaya we have to follow because Samhita says so and it's an Apta. Then in the body also, when some kind of secretions happen, yes, these kind of processes also happen in the body same way. That's why this example. Now coming to the human body inside. Every word they use is very much precise. Now talking about that, next example, many times is Unduk Puchha Shodh. Why I have selected this is from Sushruta Samhita, which gives the process of Garbha Nirman, and that it gives peculiarly things about organ development, organ formation. And if that is taken and studied with the help of Charak, what we come to, that I am trying to say. Involvement of dosha dhatu mala, it helps in various diseases of those organs while they are getting generated over there. How the organs are developed or generated in the body. Example is, nowadays we get appendicitis cases. Unduk Puchha Shodh is appendicitis, ऐसे एक trend है बोलने का. Unduk Puchha is not mentioned in Granthas, then how to work about it? That's a question. I say Unduk Puchha Shodh is there. Unduk Puchha is not mentioned in the Grantha, but Unduk is mentioned in the Grantha. Puchha is a part of it. Granthas say we don't have to mention about the Puchha, but we have mentioned about Unduk. Now how I have to proceed? Unduka Nirman is simple two words, Rakta Kittat. Raktasya Kittam we know as Mala. Raktasya Malam. Raktasya Mala is nothing but Pitta. Now, if we say Pitta, then Pittasya Chikitsa is Virechana and Raktamoksha. This is a basic sutra which we know. This is not a too much rocket science for us as an Ayurvedic community. Now, if we say Virechana and Raktamoksha is there, then I can bifurcate this into Avegakal and Vegakal. Avegakale, Virechan can be a Samanya Chikitsa, which is there in the practice of Vruddha Vaidya Parampara since ages. And further management based on Dosha Sankalpana, because Ayurveda explains every disease through Vat Pitta Kapha. So, Ekaja Dosh Vikruti Janya Rog, Dvandva Dosh Vikruti Janya Rog, and Tridosh. These are the types. So, if any old or new disease is there, we have to categorize it, then we have to categorize it in Dosha Sankalpana. Then that further management will be there based on Dosha Sankalpana. Now, talking about Vega Kale, there is a Vruddha Vaidya Parampara where if a patient comes with severe pain at that area, and if you diagnose that, then simply taking out 100 or 150 ml blood from the nearest sira helps the patient to subside the pain, helps the patient many times to get converted into an acute to chronic phase. Plus, if there is an emergency of surgery that it is going to burst, that avayava is going to burst out, if you feel so, then this kind of Raktamokshan treatment helps the patient to subside and to gain some time to reach the hospital to go for further management. This is already there in Vruddha Vaidya Parampara as a practice. And that's how Grantha also gives us the directions. Because Unduka Nirman is Rakta Kittat, Raktasya Kitta is Pittam, and Pittasya Chikitsa is Virechana and Raktamoksha. This is how we can come to conclusions of various diseases, whether they are mentioned in the Samhita or not mentioned in the Samhita. These are few examples, random examples I have chosen to keep in front of you, that how Grantha can tell us to lead in which way. Because many times it happens like patients come to us, and even many Ayurvedic doctors also say, सर ऐसा ऐसा केस है, आपने कभी पहले ट्रीट किया है क्या? तो अगर HIV का केस आता है एंड द पेशेंट आस्क, सर आपने कभी ऐसे ट्रीट किया है क्या, तो उसको क्या जवाब दोगे? या कोई भी पेशेंट आता है तो क्या जवाब दोगे? ये जनरल पॉपुलेशन इफ आस्क यू, वी कैन स्टिल अंडरस्टैंड, बट व्हेन अ वैद्य आस्क यू, that hits very hard. Because if you are not following the Grantha, you can come to these kind of questions. If you are following the Grantha, you are sure any disease from old or in the future also, best example is COVID-19. I don't know how many have come up with their own diagnosis for COVID-19. But we can come to the conclusions, we can come to the Nidan part of it, and based on that Nidan, we can do the treatment. Otherwise, it is very simple to say the case is of hypothyroidism and I give this Ayurvedic treatment. The diagnosis part is of modern science, treatment is of Ayurveda, so it's basically a jugaad in today's world. That should not be a case. Whatever name any other science has given to a disease, Ayurveda has its own diagnostic methods which are to be practiced or which should be practiced by every Vaidya to come to the conclusion of the Nidan, and based on that, whatever Grantha tells us to do as a Samanya and Vishesh Chikitsa, we have to come to that point. Otherwise, in future, a possibility is there that Ayurveda has no diagnostic methods, but it has treatment for all kind of diseases in the world. That should not be a case, because it's a strong point of Ayurveda that it's an individual science. It has its own methods for Nidan, Samprapti, Chikitsa, everything. And that should not be lost in the time because we don't practice it. That should not be the case. Now, second example is Antra Guda Basti Nirman. In this shlok, Asruja Shleshmana cha api yah prasadha paromata tam pacchamanam pittina vayu cha api anudhavanti. These are the words which are of importance. Why? Because Asruja and Shleshmasya prasada bhuta bhag. When we say prasada bhuta bhag, we have to go on parinam apadyaman dhatu nirmana prakriya, explained in Dhatu Nirman. That process is expected over here by Sushrut to understand for us, to understand how Antra Guda and Bhakti are getting formed. Pittasya Pachaman Prakriya, Vatasya Vivechayati Munchati Karma. All these are mentioned in Granthas. Those are getting involved over here, where Asruja means Rakta and Shleshma means Kapha. These two components are taken, they are processed by Pitta first, then Vivechan, Munchan. These Kriyas happen at that core level where Avasthapak is the key, and in that all the Nyay, Vad help us to understand the process. That's why these Nyay and Vad and Knowledge Siddhanta are most important. Even Tantra Yukti is most important. If we don't understand this process, we will not understand how the Antra, Guda, Basti are getting formed. Because Pittasya Ushma of various degrees, this is a point to consider. Body decides at what temperature the Antra is going to form, at what temperature the Guda is going to form, at what temperature the Basti is going to form, because that is varying for every organ, and that is decided by the Pitta and Vata in the process. This is, if we understand, then we can go ahead with that with a clarity. Now coming to, started from Vat as a dosh, and now coming to Vatasya Karma. Since my childhood, I have seen many people discussing with my father, then in college life, then in practice, then in seminars, then in everywhere. Generally the questions are in a way, thyroid hai to usko Ayurved mein kya bolte? फलाना फलाना चीज है तो what is it called in Ayurved? कैंसर को आयुर्वेद में क्या बोलते हैं? एक थॉट प्रोसेस ऐसा भी हो सकता है, ये बताने के लिए ये स्लाइड है. It's a long shlok, but I have taken only first part of it. Sramsa Vyasa Vidhaswapa Sadaruktoda Vedanam. First year के बच्चों को पता होगा, when exams come, these kind of shloks are not good for students to by heart. But if we take only one term, Vyas, and if I take an organ, Rud Vyas is a word I am getting. It's a paribhasha. If Rud Vyas is there, then what is cardiomegaly? Such kind of thoughts should come to our mind. Is it the same or is it different? If I take word sankoch, if I apply it to mutra gavini, or which is called nowadays urethra, then what is stricture urethra? Mutra gavini sankoch and stricture urethra, are they same? These kind of thoughts should always keep coming in our mind. If we take Vedana, Shul, Ruk, Tod, Bhedavat, what are these? Modern science also says cutting pain, shooting pain, pricking pain, and a long list of pain types are mentioned even in modern science. We also have these kind of things. Why I am emphasizing this? Because we also have our own method which we can follow very easily without learning any other science. And we can be individual, we can be independent in our thought process. If I take Parushya as a term and if I apply it to Tvacha, so Parusha Tvak or Tvak Parushata, these terms are there which show extreme dryness or scaly skin like a fish. What are these terms, Parusha and all? Ruksha, Khara, Parusha, these are gradations of dryness. That's how we have to grade the patient. The skin of the patient, we have to grade in this way. It shows us the degree of severity of the ailment. This is a process of Ayurveda, which is not too much different from any other pathy. But it is individually mentioned over there in Grantha. That is the speciality as per me. Based on this, if I take each and every organ of the body and I start applying each and every term to that organ. So suppose I take pupus, pupusa sraunsa, pupusa vyas, pupusa vyadha, pupusa swap, pupusa sad, pupusa ruk, pupus tod, pupus bhedanam, pupus sanga, pupus angabhanga, pupus sankoch. We can make a list of each and every organ mentioned in Ayurveda. We can make a huge list of diseases, avasthas, and then we can keep it in front of the world, all the other sciences, that we have all these diseases, the possibility of diseases, we have a list. So instead of asking for what is called thyroid in Ayurveda, please answer this. What is Pupusa Sraunsa as per modern science? What is Pupusa Vyas if it is happening? What is Pupusa Vyadha? You will be covering all the physiological problems. You will be covering Sharira Kriya, Sharira Rachana, you will be covering Chikitsa, you will be covering Shalya Chikitsa, Shalakya Chikitsa, everything. So if we take, when I say Shalakya Chikitsa, if we take Netra and if we apply each and every term to Netra, then Netra Sraunsa, Netra Vyas, Netra Vyadha, Netra Swap, all these conditions, they are there mentioned in Ayurveda. Granthakars mention this because they expect from us to lead this way, so we can understand these many ailments are there in the world which can come to you as a case. And we have to diagnose them with this way and then treat them with the Samanya and Vishesh Chikitsa Siddhanta given in the Granthas. As per last 15 or 18 years experience, where Charak is the oldest, then came Sushrut, then came Vagbhat. This is a history we learn. But what we learn out of that, this is my personal opinion, that Vagbhat says whatever is useful in current era, I have taken from Charak and Sushrut. If I start believing that statement, then I believe, or rather I will have to believe that Charak has some things which are not useful in today's era because Vagbhat has skipped it. Is that the case? I can't see that. I can see still Charak and its every statement done is useful in current era, is going to be useful in future also. And that's why, if that is an opinion of Vagbhat, then as per the aptas, Charak is the oldest apta. So I will listen to Charak, I will not listen to Vagbhat. If it is crossing somewhere the Charak Samhita. If it is not crossing Charak Samhita, if it is in line of Charak Samhita, then I will accept Vagbhat as my apta. But if it is crossing Charak Samhita, then I will not listen to Vagbhat, I would rather listen to Charak Samhita. Same is the case with Tikakar. If any Tikakar is going or crossing a line somewhere with the main text, I would rather not listen to the Tikakar, I would rather listen to the main Grantha and then the Tikakar. So the confusion will not be there. Otherwise, there will be only confusion that this is saying this is saying that, and we will be totally blind. And if we are blind, we will stop following our things, we will start adapting the things from other places. Best example is nowadays we see, you open Facebook, you open YouTube, we see the videos are going viral everywhere where the bones are getting cracked and patients are getting relieved from the pain instantly. This is the best example which is lost somewhere because nobody did something for it. But now in US, they have worked on it, they have studied it in their own way, they have established their processes, and they have come up with the course called chiropracticing, where people are getting degree of full-fledged courses and people are getting degree of it as a chiropractitioner, and they are doing the same thing. I do it in my own practice since very long. If a patient comes to me and if I see that this is fitting over there, if a patient, say example, with severe giddiness comes to me and if I see that cracking a bone over there from your neck is going to heal that patient, I do it over there and in 2 minutes the giddiness stops. These are the practices which were there in the practice since ages. We are losing them one by one because we are not following the Samhitas as they want us to follow them. That's the basic tragedy behind it. Should not be the case with the younger generation, because younger generation when get pass out after third year, they are having their degree after 1 year or 1.5 year internship. They are having their degree. That doesn't mean they know Ayurveda. They need to understand Ayurveda with this process from first year itself. This is my opinion and rather my strong opinion. I'll stop over here. Thank you very much for listening to me very calmly. Thank you.